Hi again, Dr. Emily Kirby here, board certified plastic surgeon at Kirby Plastic Surgery and Kalos Medical Spa. We had some great questions yesterday after the videos. One of the questions that we got was about what do you do if you think you have coronavirus, where do you go, and who needs to be tested. So the important thing right now that you've probably heard is that coronavirus does not necessarily affect everybody the same way. You've probably heard that kids are not as affected in general as adults. They don't really know exactly why that happens, but the risk of getting the disease and the risk of showing symptoms and the risk of mortality or dying from the disease is significantly lower in children. However, it is significantly higher in patients who are over 60 years old. If you have high blood pressure or diabetes or heart disease, you are at a little bit higher risk of having more severe symptoms and you are at higher risk of mortality. That means there's a higher risk of dying. Even if you yourself do not have high blood pressure or diabetes or heart disease, think about everybody around you who you know who does. We all know somebody with one of these issues that they battle every day. And think about protecting those people and others around you who you don't even know might have these issues. And that's why we're practicing social distancing and closing and protecting ourselves and our community from the rapid spread of this virus. If you think you have coronavirus, if you have mild symptoms, and the earliest symptoms are fever, cough, and shortness of breath. If you have these, but you're doing okay and you're not in distress and you don't need something emergently, stay at home. Quarantine yourself. Do not go into public. Do not be around your family members. Find a place in the house that you can call your own and isolate yourself from your family. This is one of the best ways to help control the spread. We are not able to test every person who we think has coronavirus. There are a very limited number of tests, and the other problem is that the tests results take about 5 to 7 days at this point. We hope to have a faster test soon, but even then we're talking about maybe 2 to 3 days of turnaround instead of 5 to 7 days. So there is not a quick answer. It's not like getting tested for the flu or getting tested for strep throat like we're used to. This is a new and different disease, and they are rapidly developing tests for this coronavirus, but we're not there yet. We're still working on it. So there are a very limited number of tests. If you have mild symptoms, stay at home and quarantine yourself. Monitor your symptoms. If your symptoms worsen, such as a higher fever, a worsening cough, increasing shortness of breath, and you think that you need more urgent medical care, you can call an ambulance or you can go to the ER. If you do any of these things, tell the dispatcher for the ambulance, tell the dispatcher for 911 that you think you might have coronavirus. If you go to the emergency department, call ahead and tell them that you are coming and that you think you might have coronavirus. This allows your healthcare workers and the people on the front line who are there to help you to protect themselves and everyone else around you from spreading this potential disease. At home, if you stay at home and you think you have symptoms, wipe the countertops, doorknobs, refrigerator handles, microwave handles, anything that you touch on a regular basis. You can wipe these down with Clorox wipes. You can use bleach diluted with water to wipe these things down, but clean those surfaces. Avoid sharing cups and plates and things like that and passing them to family members if you think you might have these symptoms. Cover your cough. Don't touch your face. You've heard these day in and day out from everybody, but there is truth to that. If you saw the video we just put up about masks, you'll know that the coronavirus is spread with droplets. It is aerosolized. That means when you breathe and you talk and all of your air comes out, the virus tends to come out in that form. So cover your cough with the elbow. Don't use your hands because then you're likely to touch something with your hands. But cover your cough and protect yourselves. Stay safe, Fort Worth. Be careful.